We started an organization with three of my friends. Mr. Dima Iluindula, who's standing next to me, and Mr. Christian Zinga, who's not here, is in Boston, Massachusetts. Before we start, I would like to see if people in the room could show if they have a cell phone. If you have a cell phone, can you hold it up? I see almost everybody in this room has a cell phone. Everybody uses technology in this room. In the Eastern Congo, there's 4 minerals that are found, which are the main minerals in the Eastern Congo. There's gold, tin, tungsten, and tantalum. They're usually used on a lot of devices that we use today on our daily lives, such as cell phones, laptops, cars, washing machine, and so on and so forth. In the Eastern Congo, there's armed groups that traffic this mineral to be able to gain money and commit crimes in the region. And these armed groups, most of the time, use sex, rape women as a weapon of war. Today in the Congo, they say for each hour that goes by, there's 48 women that get raped. So the time we spend here, so for each hour we spend in this room, there will be 48 women that will be raped in the Congo. In the last 17 years, nobody's talking about these atrocities that's happening in the Congo. We're not saying, we wanted it to be a voice for the people of the Congo. And stand up, because ourselves are from the Congo. We could have been those victims. It could have been us dying. It could have been us being abducted. It could have been our mother, our sister being raped. So we wanted to stand that. Right now we're working with an organization called 1 Million Bones. And together we're putting together an event that will be in June 8th in Washington, D.C., where we're gathering people throughout the United States, crafting bones out of clay. And in June 8th in Washington, D.C. on the National Mall, as Dr. King stood on the National Mall, we also will stand on the National Mall and lay 1 million bones on the ground to show the people the effect of genocide in the Congo and throughout the world. In a humanitarian effort, we work with hospitals and other organizations locally on the ground in the Congo. We work with hospitals such as Panzi Hospital with Dr. Mukwege, a renowned doctor that helped women that have been affected with rape and atrocity in the Congo. We also work with Health Africa and other hospitals, and we try to provide them with equipment, medical equipment, medicine, and anything. But what's more important to me is not the past. What is important to me is what will we do in the future. I'm a believer in people. I'm a believer in humanity. I believe that if we stand together and we decide to make a change for the Congo, we could be able to do it if we stand together.